Hi there, I'm Dr. John Tann with Metabolic and Bariatric Specialists. Just wanted to talk to you about the duodenal switch. There's a lot of questions about what a duodenal switch is, and there's been a lot of history around different types of bypasses and switches and biliopancreatic, and you'll hear all these words when you look up stuff online. What I want you to focus on is what we're doing now, and it's really important, and it's one of the best surgeries that we've looked up and found and discovered for severe obesity and severe diabetes. It's even more effective with diabetes than the gastric bypass, which is already extremely effective. But when we look at people that have a BMI of 60 and 70 and 80, 90, 100, there's more severe disease there, and we're seeing more of that as obesity and metabolic disease progresses. And so with a duodenal switch, it's a little bit of a combination between the gastric bypass and the gastric sleeve. We're getting elements from both, which is what allows us to make it a better, more effective surgery for severe disease. So when we look at a gastric bypass and gastric sleeve and duodenal switch, we talked about 60% and 70%, and this is going to be 80% excess body weight on average. And so it's a little bit more in terms of the amount of weight loss that you're going to get. So when we're doing the duodenal switch, you're going to get partial sleeve. So it's not going to be the same really tight sleeve that we saw before with a gastric sleeve. This is going to be part of a switch sleeve because I want you to have a little bit more room to intake food, but I still want to capitalize on removing those hormones and that gut signaling that your stomach does. And then we counted down from the top before with the gastric bypass. Here we're counting back from the end. So where the small bowel goes into the colon at the terminal ileum, we go find that section and we count backwards around 300 centimeters. And we bring that up and we're gonna hook that in. But before we do that, the reason that the duodenal switch is a trickier procedure is because of the dissection that we have to do around the duodenum. After the stomach ends, which is about right here, we need to dissect down the duodenum about 3 centimeters, which is not very far, and make sure that we don't hurt any of the pancreatic drainage, any of the liver drainage, and get a good portion to go across with our stapler load. And so that's gonna be about right here, because I wanna have the natural stomach valve still left in place. And then that's where we're gonna hook up the ileum to the duodenum. So that's gonna be an ilioduodenostomy, which is the fancy word where we connect those. So this is what that looks like. So we bring up this loop, and this is gonna be a loop that the anastomosis is right here on that duodenum, right there at the end of the stomach. And this is gonna be 300 centimeters, which means we have about 300 centimeters on this side. So now the food comes down and goes into this stomach and digestion starts here. Well, where are the enzymes coming from? Remember, imagine, for, if you will, that area that we saw, those pancreatic and the liver enzymes draining out, and those are gonna come down, they're gonna go through all this 300, and then they're gonna come all the way up here, and that's where they're gonna interact with the food, and then that's where digestion continues for the rest of the way out after that. So a little bit less digestion and a little bit of that stomach change, and that's what makes this a little bit more effective. And this is gonna be about that 90% more effective at curing really severe diabetes, and this is gonna be an option even for people that have a bypass that still have persistent disease and have a gastric sleeve and still have persistent disease. We can change them from those to a duodenal switch. We do a lot of duodenal switches, and that's really important when you're looking at this type of procedure because you need extra special care and extra special multidisciplinary teams taking care of you when you have more severe disease. So that is the duodenal switch. If you have more questions about this, please let me know. Otherwise, we'll look forward to talking to you in later episodes. Thank you.